Welcome to the Reprioritizing Self YouTube channel where we discuss tips, strategies, and the real ish that comes with reprioritizing ourselves in this society. This channel is for any and everyone who does a fabulous job at taking care of those around them, but always ends up putting themselves lower on the list. I am Larisha. I'm a counselor, wellness facilitator, and founder of Wellness Brand with Love LC.
And I am Kiera. I am a healer and trauma healing coach, and we are your co hosts. So excited for today's episode. Today we are going to be exploring the power of touch modalities. And these are things like chiropractic care, physical therapy, even self touch, right? And how we can use these for our own healing journeys. Dr. Joi Gaddy Egbuniwe is here to share how she uses touch modalities to help heal others and herself. So we're going to be inviting Dr. Joi soon here in a bit, but as you all know, we've got some goodies. You all know
Yes,
how to
y'all.
do
So make
it.
sure you stick around to the end of this episode. As always, we're going to share our crystals for this episode, affirmation, and journal reflection to support you on your healing journey. If you have not yet, make sure you subscribe to our channel, hit the notification button so you know when we are posting, as well as smash the like button and share with your loved ones this amazing healing resource, y'all.
Spread it around, spread it around. All right, y'all. So we're going to get ready to get into our topic for today. And so I'm going to introduce our guest, Dr. Joi Gaddy Egbuniwe. I'm going to bring her in here. So I'm going to read Dr. Joy's bio. This is a good one, y'all. So listen up. Dr. Joi is a doctor and visionary at the forefront of addressing the maternal healthcare crisis and an expert of physical modalities geared towards healing touch. She specializes in perinatal chiropractic care, pediatric cranial care, physical therapy, pelvic floor rehabilitation, doula, natural childbirth education, nutrition, dry needling, craniosacral therapy, Reiki, and functional medicine. Okay, yes. Okay. And as a wife and a mom, she's experienced firsthand the lack of maternal support. This, paired with her passion for enhancing the lives of women and families, has led her to establish a groundbreaking perinatal and pediatric wellness clinic in Columbia, Maryland, where she offers a team of providers from lactation consultants to yoga specialists to help the growing family unit. With an impressive background in medicine and a deep understanding of the complexities surrounding maternal health, Dr. Joi has honed her expertise to create a haven of care and support for those navigating the crucial phases of pregnancy and early parenthood. Dr. Joi helps women and birthing people have better, healthier, safer, and more enjoyable pregnancies, which leads to better maternal and fetal outcomes. Her work is saving lives daily, y'all. We hear it. We know this. So, welcome, Dr. Joi. We're so excited to have you. Thank you for being here.
I'm so excited to be here. Thank you. This is my first podcast ever.
Yay!
Yay! We're so happy to have you here in this
Yeah.
space. So, what we love to do when we get started is start with a check in question. So, our check in question for today is: in what ways are you inviting your senses into this season?
Ooh. Okay. So, I have a couple of senses that I'm inviting. My sense of touch is a very powerful sense of mine, and maybe I'll talk a little bit more about it. But when I first realized that, wow, my power is touch, I was like, oh, I gotta calm this down. And but that's my gift. And so one thing that I'm trying to invite more in is welcoming that gift outside of when I need it, and just being honing in and honoring it even when it's times that I don't need it, or times where I'm like, okay, I need to calm this down. But it is a gift, the ability to touch someone and to know what's going on with them just when touching them, to touch and to feel, to say, oh wow, you tore this, or, oh, wow, your kidneys are inflamed. Just that ability is something that I want to honor and value more. And I also want to bring in more of my sense of smell. I think smell is something that has this amazing healing principles. And we just actually left Disney World. And one thing that I appreciate with Disney World is that they have created this atmosphere that part of wherever you are, you feel it through your sense of smell. And it's amazing. You feel like when you're in Animal Kingdom, you feel like you're in Africa because they made it smell just like how I remember Tanzania smelling. And it's amazing for that. And so one thing that I want to focus on more in this season of as I'm doing some transitions in life is honing in on that sense of smell and how can I make more of my environments smell like how I want people to feel.
I love that. I love how you are honoring the power of touch and also exploring how powerful the sense of scent is, and how that can show up in every space, indoor, outdoor, all over the place. So I love that. And Kiera, how are you inviting your senses into this time?
I was like, ooh, I don't even know what am I doing for senses. I mean, I think for me, fall is, as we're moving into the fall, right? It's one of my favorite seasons because there are a lot of different sensations to experience through the senses. So I think like just even the way that the ground feels, walking on the ground, right, comparatively to summer, when the grass is greener and lusher, there might be a little more dryness, crunchiness, right? So just kind of tuning into even how it feels to walk and just to be in, movement in different spaces, and smell for sure as well. Like I think the fall smells different than the summer. And I appreciate like the ways that the coolness starts to come in, right? So then the sense of touch and feeling on my body, what that feels like, how the sun feels different than when it's kind of blazing on you in the summer. So I'm excited for some of that as we move into a fall season, and just tuning in more intentionally to the senses. Yeah. How about you, Larisha? What you doing? How you tuning into
y'all, now you got me thinking about fall. I really love fall. Like I enjoy the summer and the spring, but the fall just feels cozy. Like you get to put on them good sweaters and layer up, and like you said, like the sun is shining, but it's like that breeze. So just tuning into that sense of like feeling nature around you, and those crunchy leaves. I love me a good crunchy leaf. Stepping on those. And the scents are so yummy. So for me, like right now, for sure, I've been being more intentional about having my essential oils and having the scents in the space. So like in my car, lighting candles. Like I have a candle lit right now, and just inviting like when you walk into a space, what's the scent that you want to smell that makes you feel inviting? When I wake up in the morning now, I'll try to light a candle so like before I leave out the house, I'll just have that scent, like just like it, being more intentional about inviting yummy scents into my space. So yes, senses.
All right, let's get into this interview. So I know I have received really amazing care from Dr. Joi, but I would love for you to share with our audience what are touch modalities and what does the power of touch mean to you?
Great question. So touch modalities in general is something that we've kind of started to refer to things that are under the umbrella of physical medicine, as well as under the umbrella of more so manipulative kind of therapies. And a term recently that people started to use has been body work. But body work really overcompasses so many different things, from energy healing to Reiki. It can be it's not necessarily just always touch. So body work is, and it's a broad term. I mean, you can have someone, an acupuncturist, to a chiropractor, to a massage therapist, to a Reiki master, all under the umbrella of body work. And so really touch healing and physical medicine is to kind of hone in on more of the subsets under people who actually touch in a method of getting people to heal. And now there's hundreds of techniques involved in that. So even me as a chiropractor, there's over 140 techniques for chiropractic. And that's one thing a lot of people don't know. There are some techniques where you walk in and the chiropractor may never actually touch you. And you may walk off the table like, wow, they never touched me and I feel better. So there's so many different types of techniques. I practice about 8 different techniques. But again, there's 140. So what are different types of healing touch, and what is healing touch? Healing touch is the mechanism of which someone comes in and utilizes their hands in order to facilitate healing throughout someone else's body or their own body. And what that means is it could be touch through acupuncture, in which they would use an acupuncture needle. Acupuncture needle is a very thin needle. It is sterile. They inject it into a certain part on your body based off the meridian system. And so the meridian system was developed over 3,000 years ago. It is a Chinese medicine type of system in which it's looking at different responses to your energy levels in different areas of your body that then promote healing or promote connectivity to another area of your body. So for example, there's a point on the inner side of near your ankle that connects directly to your uterus. If I have a mom who comes in and she is in early signs of labor and we do some moxibustion or we do some acupuncture right on that spot, it might be just enough to teeter over onto that side. And a lot of times I get a call about 12 hours later with the baby. And so that is an example of a healing modality or a touch modality. Another example is me as a chiropractor. So what is chiropractic? Chiropractic is where we utilize our hands to deliver, our hands usually mostly, but sometimes there are other techniques where there's nothing involved with you being touched at all, to deliver a adjustment to a region of the body in which that area that is having what we call nerve interference. And so which we know that the spine has nerves that come out and that control majority of our body and all of its functions. And if there is an area that is not receiving the interference, that is receiving interference and not receiving the proper control that it needs, we're able to remove that nerve interference and allow the body to heal and to adjust and react and to just have more optimal function. And so that's what I do as a chiropractor. Now, that could be through pressing on someone, that could be through stretching them, that could be through doing some mobilization of an area, or that could be through me utilizing other tools and techniques. And so that's another example of a healing touch modality. Healing through touch is amazing. It's something that's very special to me because I honestly think it saved my life and my family's life. I think a lot of people, we resort to, and there's nothing, this is not to pass judgment, but we automatically, a lot of times, would just resort to taking a medication to cure or solve an ailment. And a lot of times these things don't come without side effects, or they don't come without negative impacts on our body. It's amazing to be able to help people get better without that, to save them from unnecessary surgeries, to save them from being on medication for the rest of their life, to get them to where they're in a place where they're feeling better so they don't feel like they need those things, but their body was also saved in the process. And so that's helped me tremendously for different things that I have. It's helped my family. It's helped my kids. It's saved us from unnecessary visits to the pediatrician. It saved us from surgeries, drugs, medication. And so when I saw early on what it was able to do for me, and then I saw what it was able to do for my husband, and then now our children, it's a blessing that I get to be able to do that for other families.
Wow. So powerful. I mean, from your explanation around the plethora of different ways that touch modalities show up and exist is so powerful. And you also mentioned around how traditionally, I feel like just growing up, the traditional sense of going to the doctor or going to get support when you're having an ailment is very centered around like medication, which again, not to discount that, but also to acknowledge that there are so many ways to heal our bodies and so many resources out there. So I really thank you for highlighting that and also highlighting how it showed up for you personally, which actually segues us into our next question, which you started to touch on. How has the healing touch modalities impacted your own healing journey? Even maybe the start of it, like how you got into where you the different touch modalities, and then even how it's impacted your family, which you started to touch on.
Yeah. So, and when you ask that question, it's like so many different things come up for me because there's so many ways in which it's helped me, for me. So years ago, old Joy, which was a completely different Joy than today, was on tons of medication. Kiera will tell you, because Kiera and I have known each other since we were in 6th grade. I was always sick. I was always on antibiotics. I was in and out of the doctor. If something was to happen, randomly, a child with the largest tumor ever seen in a child in the state of Maryland, that was this girl here. And so throughout my history, I was just sick. And I wasn't going to the doctor and getting better. I was going to the doctor and reducing my symptoms and treating whatever was currently keeping me from being able to function better, but I wasn't getting better. I would still be a month later with another sinus infection, a month later with another ear infection, a month later with strep throat. And it was all the time. Then 3 months later, I'm having a surgery for this. 6 months later, I'm having a surgery for that. I was a sickly kid. I was very sickly. I then went through college, just as sick, but able to semi-function. And part of one thing that I decided in college was I'm going to reduce the amount of medication that I'm taking, and I'm going to see what that does. I'm just going to see if I just take a little bit less of these antibiotics, how much better will I get? Over time, I was like, wow, I'm not as sick. And when I'm getting sick, I don't feel as dependent on the antibiotics to get better. So that kind of opened my eyes to the fields of natural medicine. And I think everything happens for a reason. I had opportunities to go to a lot of different schools for med school, and I was not able to sleep at night. I was just keeping me up. And so I said, something's not right. I'm not going to go to med school. I'm going to be a teacher. And then I was like, and other people had some influence, and they're like, no, you're not. That's not for you either. You have to figure out what you were designed, you were perfect for healthcare, but what in healthcare is going to help you? And so I was walking to the cafeteria one day at Spelman College, and I met a man who happened to work under the provost at my chiropractic school. And he said, I just want to show you chiropractic. Knew nothing about it. I immediately go to visit. I was like, okay, I'm interested in learning because I need to figure out what type of doctor do I want to be. And I got to the campus and I had this overwhelming sense of peace that just came over me, where I had gone months without having peace. I had so much anxiety. I was losing sleep. My hair was falling out. And all of a sudden I had this overwhelming just sense of peace that came over me. I, again, knew nothing about chiropractic, but I was like, I'm going to follow that peace. So I'm going to chiropractic school. Everybody thought I was crazy. And so when I got there, I then was able to learn kind of why I was so sick and what was going on with me. I was so sick because I wasn't taking anything and giving my body anything that it needed in order to stimulate my immune system. I was so sick because I constantly was taking immunosuppressants, thinking that, okay, I'm going to stop my cold by taking this Sudafed, or I'm going to do this to stop the runny nose or to calm down the cough, when in reality, I'm just stopping my body from doing what it's trying to do, which is work through this pathogen and get it out of me. And so it kind of reframed my mind into health. Fast forward, getting adjustments completely shifted and motivated my immune system to where, on average, if we were to have the same virus, someone else is sick for 5 days, I'm usually sick for a day. In comparison to how I used to be, if someone else was sick for 5 days, I'd be sick for 10. And so that's nothing else but chiropractic care and understanding what I need to do to motivate my body. So now when my kids come to me and they're tugging on their ears, and I look inside and I'm like, oh, they got an ear infection. I don't just go give them an antibiotic. I adjust their ear. I lay them on their side and I watch the fluid literally pour out of their ear. Check back tomorrow, ear's cleared up. And so those are the kind of things that physical touch can actually help with. one of the number one reasons where people bring their kids to me is for ear infections, because they've gone to the doctor, they've had 10 or so ear infections in the past 6 months, and they've done antibiotics over and over and over and over. And will an antibiotic take away an ear infection? It will. It'll wipe it out, but it'll come right back if you haven't gotten to the root cause. And if the cause is related to their fluid retention or their transfer of fluids throughout their brain, and that's a whole nother separate issue, a whole nother separate conversation, then you need something that's going to allow for their body to fix and work more optimally. And adjustments and manipulations can help with that. And so those are things that I've seen. My husband played football, and the chiropractor is what kept him on the field. And so our family has been significantly impacted in a way in which it became a no-brainer for me of how I have to then provide this to my community.
I love that. So real. And the journey and the different places that it touched and became relevant is really powerful to hear, right? It's like the alignment that we all have, right? To getting to our purpose work, to getting to the things we're supposed to be doing. And the ways that we find that, we all have a different story, but it's really cool to hear how the feeling of peace, the feeling of like, I am here. This is something that is for me, right?
I don't know
really
what
cool
this
to hear.
is. I don't know.
Yeah.
But I'm gonna do it.
But I'm here, and I'm ready to receive. And just being open to, right, exploring that with the person that you saw, not turning away from that and seeing, okay, is this something that I could be interested in, is really cool. And yeah, even just your your examples of how it is working for you and your family, especially with the ear infection, like, wow, I'm like, ooh, I'm interested. That sounds sounds so
That's
cool.
something that so many people go through. And unfortunately, the only option is antibiotics or giving it time. And then if your child continues to have ear infections, we then usually send you to an ENT, and they recommend tubes, which is a surgical procedure. And so it's wonderful to be able to provide this to the community so that they can see, like, okay, there's another option out there in which we can try these things first before we go and do something that's a little semi-permanent.
Yeah, exactly. There's more than jumping straight to the like medical, the like surgical interventions, or having to take pharmaceuticals and things like that. So this is, again, really awesome segue into the next question. But I'm wondering how people can start to incorporate healing touch in their own lives, like if they have somebody who is a doctor and has a lot of the expertise that you have, but also for folks who maybe don't have access to that, how they can start to incorporate that healing touch in their lives as well. So across the board.
So everyone needs a chiropractor. So you should try to find a chiropractor. And finding a chiropractor sometimes is like finding a therapist. It's not necessarily, you got to date a little bit. You got to see if this person's for you. If you like how when they touch your body, if you like how you feel when that happens. Not everyone is always for anyone. I have a very niche practice in which I see people who are of the perinatal field and then pediatrics. So people who want to be pregnant, are pregnant, or just finished being pregnant. That's kind of my field and the specialty for the most part. And then kids. So I practice very different techniques. And so some people who maybe walk in who are looking for someone more forceful, someone who has a stronger touch. And some people, they walk in, they're like, I just want to be thrown around the room real quick. I'm not your person. I'm not your person. So there's somebody for everybody. And you have to kind of know a little bit of what you like to, and how you want to feel, to then kind of find that person. There are more aggressive techniques that probably majority of you have seen on YouTube. And then there's way more gentle techniques that probably a lot less of you have seen on YouTube. All of them will make you feel better. But it's just knowing what you like. I think to start with your chiropractic journey, I think you should try to find someone in your area, because you have to kind of mix your lifestyle with convenience. It's not great a lot of times where I hear patients and they're like, I'm coming to you and I'm driving an hour. Well, that's not helpful for you, because every time you have a problem, is it feasible for you to then drive an hour for you to come and see me? And if not, then that's not going to work for you. So definitely you want to find someone who's local in your community, check their reviews, check what techniques they say that they practice, and then call the staff and ask. That's usually a great way to kind of find out if this person will be right for you. Before you get there, there are things that you can do, like touch yourself, to then be able to decide whether or not this, you even enjoy touch. Some people don't enjoy being touched. I have some patients who come to me with fibromyalgia. They do not enjoy being touched. So finding other options for them is best. But I want everyone to leave, because I think one thing that a lot of us feel are just our everyday aches and pains. We just feel it. And I think normalcy in society is, okay, I have pain, I have a headache, let me go take some medication. And I think if we can just get people to figure out other ways to kind of get their pain to go, or to help them ease their pain without medication, and healing touch is one of them, that will help tremendously. So let's start with trigger point releases. So I'll use my hand as an example. And I probably have tons of trigger points. Yes. So whenever you're rubbing an area on your body, you know how you rub and you're like, that's the spot. Usually that's a trigger point, and that's an area that is what we call hypoxic tissue. So that area is not getting as much oxygen as it needs, and therefore it becomes really tight. The first thing you should do is, so if this is my little trigger point, you press into that area and then relax the rest of your hand. Okay. Count to 3. 1, 2, 3, and then release. And then do it again. Press in again and go in a couple millimeters deeper. Count to 3. 1, 2, 3, and then release. And then you'll do it for a third time. This time, as you press in, you're going to add that with a gentle massage towards where the tissue or the muscle is flowing. So if the muscle is going this way, you do a gentle massage around the way. The muscle's going that way, you would then do a gentle massage that way. Okay? And then release. And then see how that feels. Might feel better, might feel looser.
Yes, demos. Thank you. That was so good. Look, y'all, we got an example right here. You feel a little something, go on and press in. Take a spin on with this and see how that works for you. And I just appreciate you, Joi, saying like not everybody enjoys touch, right? We're really, all about consent here. We're all about honoring the ways that your body wants to experience a healing modality or not, right? And so again, y'all, if this is something that resonates, take it, try it out. If you're like, I did it and it does not feel good, that's your permission to say this is not for me right now, right? And you can try it again later down the road if you want to, but the point is that we're honoring where we are in each moment. So thank you for naming that too, Joi. I appreciate it.
May I add something to that?
Yeah, please.
Be honest with whoever you are seeing, if it's a partner who's going to be touching you, or a friend, or a provider. Tell them your history. Tell them how these things have made you feel in the past, whether you were welcome to it, you weren't welcome, you maybe had a previous experience. I do have patients who come in who I'm the first person they've allowed to touch them ever because of a previous experience, whether it was going to a previous chiropractor and they've, traumatized them in that way, or if it was a sexual assault. Because of whatever previous experiences they've had in their life, they may not be welcome to touch. And I think being very vocal of that, because I then say, oh, I don't have to touch you to make you feel better. That's fine. Let's do some other stuff and I'll let you touch yourself as we do this together. And they've been able to get results where they still feel better and they're still able to continue. So even if touch is not something that you do like, hopefully you can find a provider that then has an array of different techniques who can then help you in other ways.
Yes, thank you so much for sharing that. That is super important. I love that you also shared at the start around like finding a chiropractor is like dating. You see how you feel when you're in their presence, what what do you take away from if they have a online presence, or if they have like their reviews and things. So really taking the time to put energy into like seeing if this person works for you, and their approaches work for you, and being open to exploring multiple options. Because I feel like sometimes it can be discouraging, when you're trying something for the first time, and then you get really excited, and then you walk into that office and it's like it's not giving, and you're like, dang, I just did all of this for this person,
and walk out.
Compatible. Yeah, exactly.
Walk out. You know what? I appreciate y'all. Y'all have a great day. Bye-bye.
Yes.
No hard feelings. And maybe they'll feel a certain type of way, but that's fine too. But you again, reprioritizing you. This person wasn't going to be able to serve you. You maybe weren't going to even be able to be receptive to them serving you in that capacity. And so there's no point in you staying there and wasting your time or theirs. And they'll appreciate that.
Yes. Okay. So this is bringing us to our next question. And this is personal, for you. So what are your current offerings and services, and how can people connect with you? So again, let us know where you're located, and then how folks can connect with you if they're interested.
Wonderful. So I am in Columbia, Maryland. I own a perinatal wellness clinic, and where we specialize in everyone who is in that perinatal period. So if you are interested in having a baby, currently about to have a baby, just had a baby, thinking about your next baby, that's us. We are not far from Columbia Mall. So if you're familiar with Columbia, Maryland, we're not far from Columbia Mall. We're pretty centrally located. It is myself. I also have a yoga specialist here. I also have a lactation consultant, and we do everything from perinatal chiropractic care. I also do functional medicine, which I would like, if you guys have some extra time, for me to dive into, because I think that's something that a lot of my community and a lot of people in general do not know about. So I'll dive into a little bit about what functional medicine is, and it's the newest up and coming form of medicine in general. And so we also do, I do craniosacral therapy. I do dry needling. We have cold lasers here, ultrasound machines. We do pelvic floor rehabilitation, diastasis recti rehabilitation, physical therapy on just like your general ailments from your knee to your ankle to your shoulder. We have a lactation consultant, again, yoga specialist. I think I might have mentioned that. And so pretty much just helping people and through this matriculation into parenthood. We are focused on helping the parents pretty much, as well as the children, but we're really focused on helping the parents. So we do provide a lot of education. We also hold a lot of birth support classes here, childbirth education. We also hold breastfeeding support groups, because breastfeeding in itself is a full-time job and a journey. And that by itself needs way more support than what our community provides. And so we do host classes here for that. Our goal is just to help as much as we can in ways in which we see that people need that help and support, so that you can have that journey that you want for yourself.
Well, tell us about the functional medicine. We want to know.
Thank you.
The up and coming medicines. And please tell us too how we can, or how we in the audience can engage in that if they're interested too.
So functional medicine is very different, and I'll use some examples. And thanks for asking. Not that I plugged it in or anything, but functional medicine is all about getting to the root cause of disease, and not disease, but dis-ease in your body. So your body's inability to be able to adapt to its environment, and it therefore coming up with a process. And so I'll use there's so many different examples. I used kind of the ear infection example earlier on how I treat ear infections from the chiropractic perspective. There's also perspectives from functional medicine, and it would be to figuring out why this child is continuing to get ear infections, what's happening with their immune system, what's happening with their body, what are we seeing functionally that's not adequate enough for their body to be able to resolve this on its own, because we all have this super powerful immune system within us that wants to be able to get to the bottom of some of these things. So that's what functional medicine is. In the example of diabetes, you have diabetes, a good amount of us do. And you walk into your doctor and they maybe prescribe you metformin or insulin. They prescribe you something to treat the diabetes. The perspective from functional medicine would be more so to figure out why your body is not producing enough insulin on its own. And then to get to that root cause of that, to then motivate your body and to stimulate it in a way to then produce the insulin, and so that you don't need the metformin or you don't need the insulin medication. So that is functional medicine. It's not necessarily treating a symptom or treating what is presently going on, but more so getting to the root cause of where there's a break in the person's body to where they're not able to do these things on their own. And so that is really how we should look at health. I'm very passionate about that, because I think part of a lot of things that we do is constantly treat the symptom. We're taking, we need a medication for us to sleep. Now we need another medication to treat the symptom of the fact that we need this medication to sleep. And now we need another medication because we're having heart palpitations because we're taking this other medication. So it just trickles. And so, but many of this can be solved if we just get to the root cause of what's happening with that person.
Love that. Yeah. I mean, that is that's the Western way, right? You just like mask it with a medicine, or there's treating the symptoms, right, but not the actual cause. So I really love that approach, and I think it's so important for actual like relief and health and healing for us. So thank you for sharing that. It's very much in line with the way I'm learning herbalism, and really seeing it from a broader perspective, even spiritually as well, how that can be impacted and cause ailments and different things in our bodies. And the liver, off of all these medications, is getting worked. So, giving a break to the liver as well. So thank you. I mean, I feel like I learned so much. I'm ready to practice my trigger point self-massage right now.
Yeah.
I know that's my number one takeaway, but I really want to appreciate you all. This is my best friend from, as you heard, 6th grade. So we've known each other and seen each other grow through so many things and just so many versions of ourselves. And I just want to say how proud I am of you and all of the work that you do, the ways that you're making significant changes in like Black women's experience, Black birthing people's experience of childbirth and pregnancy. It really matters, because y'all know our stats, they don't look good. And we need people like Dr. Joi that can give us the information, that can be there as someone who really cares about us through the process. So I just want to appreciate you for taking time to be here when you're doing all of that out in the world as well, being here and sharing with the community and our audience, and just opening our eyes to a different form of caring for ourselves. So I appreciate you, and I'm so grateful for all that you've shared today with us.
Thank you. Thank you.
Absolutely. So we're getting into our crystal, and this crystal was actually brainstormed and brought forth by Dr. Joi, and that is amethyst. So we're going to talk about amethyst, our crystal of the month, the episode. We've got our babies. Larisha's got a baby. I got this big mama amethyst, okay? So this is amethyst, and I'm going to share a little bit about what amethyst does, how we can use it in support of our own healing. So amethyst is protective, it's healing and purifying. It's actually thought to rid the mind of negative thoughts and dispel anger, rage, fear, and anxiety. It alleviates sadness and grief. It also helps us to sleep better by calming our mind and bringing pleasant dreams. And it relieves stress and strain. It soothes irritability and balances mood swings. And amethyst can also boost hormone production, cleanse the blood, relieve pain, decrease stress, ease headaches, and strengthen our intuition. Right? So we have the spiritual piece of amethyst because it is connected to our crown chakra. And it activates that spiritual awareness and opens up, and like I said, strengthens that intuition. So amethyst is super powerful if you are interested in supporting your healing journey, right? Dispelling those emotions, relieving grief, sadness, relieving pain. I'm like, okay, get you some amethyst, y'all. Get you some amethyst. Dr. Joi, why did you choose amethyst? What is your connection to
It
amethyst?
is my birthstone.
I love it.
And everybody loves a Pisces, but no, it is my birthstone. And I mean, maybe I'm a little biased, but when you read up on all of the benefits, I can't think of there being one that has more.
Yes.
It does so much for so many people, and it's beautiful.
It is beautiful. Yes.
It's beautiful. And so it was a no-brainer when I was picking one.
Yeah.
Because amethyst is, the mecca of stone. So, in my opinion, I'm again a little biased, but yeah, and she's beautiful. She's got that beautiful purple hue. And depending kind of where your stone comes from is depending on how dark or light an amethyst it may be, but
exactly.
Gorgeous, absolutely gorgeous.
Yay.
Perfect for everybody.
Yes. Thank you for suggesting that. We haven't talked about amethyst on the show before.
Yes, thank you. I remember when I first started getting into stones, amethyst really is like the one. Like you said, it encompasses so much. And it is one of the, now that you've said that, like it is one of them stones that's like ain't nobody or no other stone is giving all that amethyst is giving. This is one of those stones I would wear in my bonnet, like when I went to sleep, to help with my dreams and just that soothing. I also use amethyst in one of my essential oil blends, so it's really just an all around loving, yummy, good stone. So thank you.
And it's cute. It's
cute. Yeah, and it's
wear.
cute. It's the senses. Like it looks good. It feels good.
All the things. I don't know if you want to walk around with a big ruby every day or other things, but amethyst is like something you can just rock every day, whether you're going out at night or to work. It's perfect.
Yeah. All right. Thank you for that crystal share. We are going to navigate into our affirmation. So our affirmation, and we like to say our affirmations in threes. So I'll say it 3 times. Our affirmation is: the love within and around me nourishes all of my senses. The love within and around me nourishes all of my senses. The love within and around me nourishes all of my senses.
Ashe. Oh, I'm putting that one up because I mean, I think it's so powerful just to connect with the senses, y'all. Like it's like something so simple, but because we have so many distractions with tech and all of the things to do, it's like that is not a priority. So connect to y'all senses. See what's going on. But yeah, let's get into our reflection question of the episode. So to go along with our healing journey and our reflection of our conversation today, we want you to think about what sort of touch do you enjoy and how can or does it support your healing? And I'll read that again. So what sort of touch do I enjoy and how can or does it support my healing? One more time for the people in the back. What sort of touch do I enjoy and how can or does it support my healing? So reflect on that, y'all. Let us know what comes up for you. If you want to share it in the comments, if you have questions about this amazing discussion about the wealth of knowledge that Dr. Joi is holding, you got questions, please go ahead and comment. We will be keeping an eye on that. We always will pass the information on to Dr. Joi too, if there's things that you're needing. And as always, we want to hear from you. What did you think about the episode? What did you get from it? What are you taking away? What are you going to put into practice right now? And make sure that you're sharing this, right? We want to spread this healing to the people who need it. So if you know somebody who is in need of the power of healing touch right now, go on to share that with them. Subscribe if you all are not subscribed already. This is going to be just one of many, many, many ways that we can practice healing for ourselves. So, tap in. We'll be back with more as always. And then you let us know what you want to hear. Y'all know we listen to you. We want to know if you love this and you want us to bring back Dr. Joi, let us know. We do listen and we do we do answer the call. So y'all just keep us posted. But we appreciate you. We're sending you love. We're sending you healing. We're in this healing journey together. So please lean on us and we'll lean on y'all and we're going to get there. I appreciate y'all. Peace, everyone.
See y'all next time.
See y'all.